Oral health is a crucial part of our well-being, but for many families in Leeds, accessing NHS dental care is a challenge. From 2022 to 23, Youthwatch ran a project called Taking Care of Your Smile, where we try to understand the challenges that children, young people, parents and schools face with dental care in Leeds.
We heard from hundreds of people through surveys and in-person workshops, and what we found was shocking.
One head teacher said you can literally smell the tooth decay in the school corridors, which is a heartbreaking statement to make.
This project started because more and more families were contacting Healthwatch Leeds saying they couldn't get access to a dentist. We received almost 4,500 hits on our dental advice page, and schools raising concerns on how poor oral health was affecting students.
With this in mind, we wanted to provide real-time advice, signpost them to the right places when they needed help, and also provide oral health promotion.
Given the high need in low-income areas, the project aims to identify key challenges and recommend improvements.
For young people, the main problems was actually accessing an NHS dentist and dealing with dental anxiety, with some even going abroad just to access treatment.
Parents and carers are struggling too. 62% of parents said that they can get their children to brush their teeth, however they just can't get them an NHS dentist.
Schools told us they're seeing kids in pain every day because they can't get access to dental treatment. Poor oral health affects school attendance, sleep quality and mental well-being.
Schools try to help by booking appointments and sending staff to translate, but they can't always do that. And dentists are funded to provide interpreters, which means some kids are left without care or presenting in emergency hospitals.
One parent said, "My daughter's filling fell out twice and we had to wait 6 months to replace it. That's 6 months of a child being in pain."
Mental health plays a key part too. Young people told us that when struggling with depression and anxiety, that even brushing their teeth can feel impossible. And for those that need braces, well, they're stuck waiting many years for treatment, which can make them feel worse about themselves.
One mum told us, "My child has been on the waiting list for 5 years to get braces, and every time we ask them, they say, well, he's on a waiting list. Imagine how frustrating that must be."
And then there's fear. Loads of us feel nervous about going to the dentist, and bad communication makes that worse. One young person told us that the dentist uses jargon and they don't always understand what's being said, which makes them really nervous.
So what do we do about it? Here's 7 of our key recommendations.
Number 1. West Yorkshire ICB to produce accessible information on how to access primary and secondary NHS dental services.
Number 2. West Yorkshire ICB to consider commissioning, providing in-school dental services and oral health education programmes.
3. West Yorkshire ICB to improve NHS dental access for children and young people from low-income neighbourhoods.
Leeds City Council Public Health to increase oral health promotion.
Number 5. Dental practices in Leeds to improve children and young people experiences of appointment, to reduce anxiety and meet specific needs.
Number 6. Dental practices in Leeds to improve translation and information for families who are not confident communicating in English.
Finally, 7. All services should continue implementing the lived experiences of children and young people in their ongoing evaluation and future planning of services.
We're sharing this because good oral health and access to dentistry is important and crucial for the well-being of young people.
And together, we can make sure our voices count in health and care services.
To learn more or support our work, check out Youthwatch Leeds on Healthwatch Leeds' website.
Follow the work we do on Instagram and TikTok at Youthwatch Leeds.